Aphorism 216. The cases are not rare in which a so called corporeal disease that threatens to be fatal, a suppuration of the lungs, or the deterioration of some other important viscous or some other disease of acute character, for example, in childbed, etc., becomes transformed into insanity, into a kind of melancholia, or into mania by a rapid increase of the psychical symptoms that were previously present, whereupon the corporeal symptoms lose all their danger. These latter improve almost to perfect health, or rather, they decrease to such a degree that their obscured presence can only be detected by the observation of a physician gifted with perseverance and penetration. In this manner, they become transformed into a one sided and, as it were, a local disease in which the symptom of the mental disturbance, which was at first but slight, increases so as to be the chief symptom and in a great measure occupies the place of the other corporeal symptoms whose intensity it subdues in a palliative manner, so that in short the affections of the grosser corporeal organ become as it were transformed and conducted to the almost spiritual, mental, and emotional organs which the anatomist has never yet and never will reach with his scalpel. Explanation. In this aphorism, Dr. Henneman has given idea about change of corporeal disease. There are many cases in which corporeal or physical diseases that threatens to be fatal, for example suppuration of lungs or the deterioration of some important vital organ or some other disease of acute character, for example during parturition, becomes transformed into insanity, into a kind of melancholia, or into mania by rapid increase of the psychical symptoms that were previously present, while the corporeal or physical symptoms lose all their danger. It latter improves almost to perfect health, or it decreases to such a degree, or it becomes so mild that their presence can only be detected by the observation of physicians who is gifted with perseverance and penetration. In this manner, corporeal or physical diseases get transformed into a one-sided diseases, just like a local disease in which the symptoms of the mental disturbance or psychic symptoms at first very mild and then it increases so as to be the chief symptom. In such a way, in great measure, mental symptoms occupies the place of the other physical symptoms. Intensity of physical symptoms becomes less and it is suppressed in palliative manner. So here the affection of the vital organs transferred and conducted to the almost spiritual, mental, and emotional level where anatomist or surgeon can never reach with his scalpel.